Ciao tutti, io sono Sława, and here my Italian ends, so please allow me to switch to English and I will tell you a story. So imagine you have a deep wound, a long tunnel that refuses to close. Fistulas are exactly this, painful, difficult to close, and recurring. Only 1 out of 2 patients get cured after surgery. And this is not just a personal burden. Over 5 million euros goes into treating fistulas in Europe alone. And I know the challenge firsthand. I've lived with Crohn's disease for years, and I developed a perianal fistula myself. Even after 16 surgeries and over 3 years of intensive treatment, healing was still out of reach for me. I couldn't wait for a solution to be created anymore, so together with my husband Matt and my doctors, we created one. And that was the turning point. And spoiler alert, it worked. The breakthrough became Semiflex. It's a set of 3D printed silicone catheters designed for negative pressure therapy. Think of it as a mini Dyson for long tunneling wounds. It's precise, it's gentle, and it's effective. Today, treatment of fistula starts with surgery, but what follows after, the drainage, is even more important. The current solution, the endosponge, is unfortunately outdated. It requires anesthesia, it's painful, it clogs, and causes reinfection. And Semiflex sorts that out. It's painless, it requires minimal hospital visits, so it reduces the cost on the healthcare, and it gives the control over life to patients. So in 2023, we partnered with Amsterdam UMC, a leading European IBD hospital. What happened is 20 patients with treatment-resistant fistulas entered the study. They've had fistulas for over 5 years, and Semiflex was their last hope, just as it was for me. And this is what happened. 65% of treatment was feasible, and 10 out of these 20 patients healed clinically after years of failed treatment. And the pain on a vast scale was just minimal. We are looking at a 6 to 30 billion euros market today, which is driven by rising numbers of IBD, including Crohn's. But the doctors are seeing something bigger already, because Semiflex is not just for fistulas, it has a chance to be the default, the first choice solution for all tunneling wounds. And this is a market bigger, it's 25 to 50 times bigger than the fistula market. So Semiflex is not just a concept, it has been designed, developed, and tested in a leading hospital in Europe. And we are ready for the next step. The experts are excited. After presenting Semiflex at an IBD Innovate conference in New York earlier this year, a leading expert, a surgeon from Cleveland Clinic, called this a killer application. Our team brought the project this far, and now we're looking for the right partners to bring this to the finish line. So if you are one of the partners, I'd love to talk to you. Thank you.